When we take a pill, we trust it. We trust that it is safe. We trust that scientists have tested it. We trust that the company making it cares about curing us. But how do those companies know the drug is safe? They have to test it. And testing drugs on humans is difficult. In the United States and Europe, there are strict laws. It takes years. It costs millions of dollars. You have to tell the patients everything. But what if you didn't want to wait? What if you had a potential billion-dollar drug and you wanted to skip the red tape? You would need a place where the laws are weak. You would need a place where people are desperate. You would need a place where a human life is considered cheap. In 1996, Pfizer, the world's largest pharmaceutical company, found that place. They found it in the dust and heat of Kano, Nigeria. This is the story of the Trovan clinical trial. It is the story of how a corporation flew into a disaster zone, not to save lives, but to steal data. It is the story of how they used African children as laboratory rats, and then fled the country when the children started dying. To understand this crime, you have to understand the chaos of 1996. Kano is a massive, dusty city in northern Nigeria. In 1996, a nightmare struck. A massive epidemic of meningitis broke out. Meningitis is a terrifying disease. It attacks the lining of the brain. It causes high fever, stiff necks and seizures. If untreated, it kills you. If you survive, it can leave you deaf, blind, or brain damaged. Thousands of children were infected. The hospitals were overwhelmed. Parents were carrying their screaming children in their arms, begging for help. There were not enough doctors, there were not enough beds. It was a humanitarian catastrophe. Groups like Doctors Without Borders, MSF, rushed to the scene. They set up tents, they worked 24 hours a day. They were using a drug called chloramphenicol, a cheap, proven antibiotic recommended by the World Health Organization. They were saving thousands of lives. But then a private jet landed in Kano. It wasn't carrying aid workers. It was carrying a research team from Pfizer. Pfizer had a new drug called Trovan. Wall Street was excited about Trovan. They thought it could make billions of dollars. But the FDA in America hadn't approved it for children yet. They needed data. They needed to prove it worked on kids. But finding sick children in America to test an experimental drug on is hard. But in Nigeria, there were thousands of sick children. And their parents were illiterate, desperate, and terrified. It was the perfect opportunity. Pfizer set up a tent right next to the Doctors Without Borders station. This was a calculated move. The parents saw white doctors. They saw a medical tent. They assumed these were humanitarian workers there to help. They didn't know these were corporate researchers there to experiment. Pfizer didn't tell the parents the truth. They didn't tell them this is an unproven drug. They didn't tell them you can go next door to Doctors Without Borders and get a proven cure for free. They just said, we have medicine. The parents, who couldn't read the English consent forms, and often weren't even asked to sign them, handed over their children. They thought they were being saved. In reality, they were being enrolled in a clinical trial. Pfizer selected 200 children. They gave 100 of them the experimental drug Trovan. They gave the other 100 the standard drug, ceftriaxone. But here is where the story gets truly evil. The Pfizer doctors wanted to prove that Trovan was better than the standard drug. So what did they do? According to investigations later revealed by the Washington Post, Pfizer deliberately gave the low dose of the standard drug, ceftriaxone, to the control group. Think about that. They had a drug they knew worked, but they gave the dying children a weak dose of it, just to make their own new drug look stronger in the charts. They risked the lives of the control group to protect their stock price. The results were horrific. The children started to suffer. One 10-year-old girl, who was given Trovan, deteriorated rapidly. Her eyes froze. She stopped walking. In a normal hospital, a doctor would say, "The drug isn't working. Switch her to the other medicine immediately." But the Pfizer team didn't switch her. They kept her on the experimental drug until she died. In total, 11 children died during the Pfizer trial, 5 on Trovan, 6 on the low-dose control drug. Dozens of others survived, but they paid a terrible price. Some became completely deaf. Some were paralyzed. Some suffered brain damage that left them unable to speak or care for themselves. And then, just as quickly as they arrived, Pfizer left. They stayed for only 2 weeks. Why? Because they had reached their target number. They needed 200 subjects. Once they had the data for 200 kids, they packed up their equipment, got on their private jet, and flew back to the United States. The epidemic was still raging. Children were still dying in the streets. But Pfizer was done. They got what they came for. The humanitarian mask fell off. They weren't there to help. They were there to harvest data. Back in the US, Pfizer launched Trovan. It became a blockbuster drug. They made huge profits. But in Nigeria, the parents were grieving. For years, nobody knew the truth. Pfizer claimed the children died of meningitis, not the drug. They claimed they had permission from the Nigerian government, but in 2000 the truth started to leak out. An investigative reporter from the Washington Post found a missing ethical approval letter. It turned out that the ethics committee in the Nigerian hospital that supposedly approved the trial didn't exist at the time. The document was faked. It was backdated by Pfizer researchers to cover their tracks. Then a whistleblower emerged. Dr. Juan Walterspiel, a pediatric expert at Pfizer, claimed he had warned the company before they went to Nigeria. He told them the trial was unethical and dangerous. What did Pfizer do? They fired him. The Nigerian government finally woke up. They sued Pfizer for $7 billion. They accused the company of illegal testing of an unregistered drug. And this is where we see the true power of a corporate empire. Pfizer didn't just fight the lawsuit in court, they fought it with spies. In 2010, WikiLeaks released secret diplomatic cables. These cables revealed that Pfizer had hired private investigators to dig up dirt on the Nigerian Attorney General, Michael Aundoaka. They were looking for evidence of corruption to blackmail him. They wanted to pressure him to drop the lawsuit. They weren't acting like a medical company, they were acting like the mafia. Finally, after 15 years of legal battles, Pfizer settled. They agreed to pay $75 million to the state of Kano and the victims. To you and me, $75 million is a lot of money. To Pfizer, it was nothing. It was pocket change. They make that much money in a few days. They paid the money, but they admitted no wrongdoing. They never apologized. They never admitted that they killed those children. But the damage went far beyond the money. The real tragedy of the Pfizer experiment is the trust gap. Years later, when the United Nations tried to distribute the polio vaccine in northern Nigeria, the locals refused to take it. The parents remembered Pfizer. They said, "The white men came before with medicine and killed our children. Why should we trust them now?" Rumours spread that the polio vaccine was a plot to sterilize Muslims. Because of this distrust, polio, which had been almost eradicated, came roaring back in Nigeria. It spread to neighbouring countries. Thousands more children were paralysed by polio, simply because Pfizer had destroyed the trust between doctors and patients. The Trovan trial teaches us a dark lesson about modern medicine. We like to think that science is noble, but science is also a business. When a company looks at a map, they don't see people, they see markets and data points. In the eyes of Pfizer in 1996, a child in New York was a customer to be protected. But a child in Kano was a raw material to be used. The Trovan drug was eventually restricted in Europe and the US because it caused liver failure. It turned out to be dangerous after all. The data they stole from the dying children of Nigeria was useless. The next time you hear a pharmaceutical company talk about global health or saving the world, remember Kano. Remember the 11 graves. Remember the private jet that left while the city was burning. And remember that in the world of big pharma, the patient is not always the priority. Sometimes the patient is just the product.